Okay.
All right, so top 10 on Jayco's Hit Parade. If Jerry goes out and rides with you, what is the proper procedure for hand washing? Anybody?
Before and after.
Before and after what?
With the bacteria gel before you go into the home. Sterilize your hands and everything.
You should always wash your hands, sanitize your hands before going to a patient's house. Ideally, wear gloves when you come out. Does anybody know how to take the gloves off?
Use the other ones.
From the wrist.
Inside out.
Inside out, fold one into the other. Then your hands are still not clean. You need to what?
Sanitize.
Sanitize again. All right. So this is the actual ABC policy and procedure on this. I'm not going to bore you with it. Please read it out. I'm not going to stand here or sit here and read it word for word for you. You guys are adults. The gist of it is to cut down on the spread of infectious disease or any other germs that will get you sick. This is the time of year everybody seems to get sick, so please do yourself a favor. With as much stuff we come in contact with and as much stuff we carry out of people's homes, just sanitize your hands. I mean, honestly, if you don't, it's just nasty. You know, I mean, if you ever looked at it, if you took a paper towel, a wet paper towel, rubbed it over your skin, with the amount of dirt and crap that you'll come off with is just amazing. So just multiply that as a 100 germ factory. So anyway, when do you need to wash them or sanitize? It just goes down the list. It goes over some office infection control. And this is basically a chart on how to rub your hands with the gel, how to wash your hands as well. I'm not going to bore you with that. Second part of it. And then we have a nice little video.
Germs are a big deal, and preventing their spread is critical in every healthcare setting. Did you know that 80% of infections can be spread by hands and contaminated surfaces? And hospital-acquired infections are the most common serious complication of hospitalization, not to mention the fourth leading cause of death among Canadians. Hand hygiene protects healthcare workers, clients, family, and visitors. When you perform basic care, such as changing a client's gown, taking a temperature, or picking up a meal tray, you can transfer microorganisms. Clean hands save lives. Hand sanitizer, or alcohol-based hand rub, is a simple way to kill bacteria and viruses on hands in all healthcare settings. Apply hand sanitizer and scrub palm to palm. Then palm to the back of your hands. Your thumbs. Between your fingers. Then scrub your knuckles to clean your cuticles. And your fingertips to clean under your nails. Sanitizer should remain wet on your hands for at least 15 seconds in order to be effective. Though hand sanitizer is effective most of the time, hand washing with soap and water is necessary after using the washroom, before preparing food, anytime hands are visibly soiled, and when in contact with select microorganisms such as C. difficile. Using soap, scrubbing, rinsing, and drying all work together to remove germs. Turn on the tap and wet your hands. Warm water works best. Use plain liquid soap and scrub palm to palm. Then palm to the back of your hands. Your thumbs, between your fingers. Then scrub your knuckles to clean your cuticles. And your fingertips to clean under your nails. Remember to scrub for a full 15 seconds before rinsing off the soap. Then dry your hands well with a paper towel, and use that paper towel to turn off the taps and to open the door. It's important to dry your hands well. Damp hands spread 1,000 times more germs than dry hands. Everyone should perform hand hygiene several times a day, especially when hands are visibly soiled, after using the washroom, after blowing your nose, coughing, or sneezing into your hands, before eating, preparing food or assisting others to eat, after handling garbage or other waste, and after handling shared objects, such as keyboards, telephones, or charts. In healthcare settings, there are an additional 4 moments for hand hygiene. First, wash in. Clean your hands before entering a client environment, such as a hospital room or client home. This protects the client from any harmful germs carried on your hands. Second, clean your hands immediately before any procedure. This protects the client from any harmful germs, including the client's own germs, from entering their body. Third, clean your hands immediately after any exposure to bodily fluids. This protects yourself and the healthcare environment from any harmful germs transmitted by the client. And fourth, wash out. Clean your hands when leaving the client environment, such as a clinic room, hospital room, or client home. This protects yourself and the healthcare environment from any harmful germs transmitted by the client. It's important to remember that gloves don't eliminate the need for hand hygiene, and hand hygiene doesn't eliminate the need for gloves. Proper hand hygiene should be done before putting on and after taking off gloves. Hands aren't the only things that come into contact with the client environment. Any item brought into a client's environment, such as a hospital room, treatment area, or client home, has the potential to transfer microorganisms. These items require appropriate cleaning and disinfection to prevent transmission. Healthcare workers are an ideal advocate for hand hygiene. Wash your hands in front of clients. Your hands will be clean, and clients and visitors will know it. Seriously though, clean hands save lives.
To squirt some alcohol hand rub into the palm of one hand, rub the fingertips and the fingernails into it, spread it into the palm of the other hand, and do the same with the fingertips and the fingernails. Make sure that all surfaces of the hands are covered, the outside of the thumbs, and keep rubbing until the alcohol hand rub is dried. The amount of rub that you use depends on the size of your hands and the brand of alcohol. Put the rub into the palm of one hand. As you spread it across the palm with your fingertips, you're starting to decontaminate both the palm and your fingertips. Pass some onto the other palm and spread it with the other fingertips. Now work on the back of both hands and in between your fingers. If you are wearing a wedding ring, make sure that you clean around and under the ring. The idea is to cover all the surfaces of both hands up to the wrists and keep rubbing until the alcohol dries. To squirt some alcohol hand rub into the palm.
The end. All right, so get out of this. Give me a second.
Do you wear gloves when you're delivering equipment too?
I'm sorry?
Do you wear gloves when you're delivering? Michael said it's fine.
Yeah, it's fine. Some people get, a little weirded that you're wearing gloves in their home, but just let them know that's for your protection and their protection. If they're uncomfortable with you wearing gloves, and and you feel like you need to because some of these houses are really, really nasty, and they don't want you coming and wearing gloves, and give me a call or Michael a call. We'll have a talk to them. You can always fall back on, it is our company policy to do this.
Or tell them to put the stuff in the truck.
No.
No, I'm not talking about picking up, I'm talking about delivery. Like a walker, wheelchair or something,
The thing is, before you make the delivery, wash your hands. Go in, make the delivery, come back out, wash your hands. If Jerry's with you, make sure he sees you do that. One time not doing it is 100% failure rate. Okay? Yes, Mark.
Has that changed? Because I sanitized before I went in and sanitized when I got out with the Jayco guy with me. It fell. I didn't fail.
Forgetting it one time is a failure rate. Is 100% failure
But you're
rate.
saying wash hands. It doesn't have to be wash hands. It's going to be with sanitizer.
Correct.
Right?
Yeah.
All right.
Sanitizer.
I thought we like had to go in. I thought somebody
No.
wash our hands. I'm like, that's crazy.
Each truck has got, it should have one of those Purell hand sanitizer.
Yeah, I've got mine with me all the time.
Yeah, so you should do that. And the proper response when asked, that's what you do. Everybody on the same page? All right. That's it. It's a quick one. All right. Thanks.